At a certain point, the skin stops responding to cosmetics. That's when you need to start speaking its language. I see it often in my clinic. Women who do everything right, consistent skincare, the right active ingredients, sun protection, and yet their skin looks dull, thin, unresponsive. I remember a 47-year-old patient, impeccable routine, but the dermis was no longer responding. It wasn't a cream problem, it was a problem of insufficient biological stimulus. Another patient in the middle of menopausal transition told me, "It's as if my skin no longer understands what I'm putting on it." She was right. In these cases, adding more products doesn't help. What's needed is to reactivate the dialogue with the dermis, stimulates fibroblasts, and give the skin a clear signal again. This is where treatments like microneedling become longevity tools, not aesthetic shortcuts. When we talk about microneedling, we're not talking about little holes in the skin. We're talking about biology, collagen, how to help the skin age better, not just look younger. Hi, I'm Dr. Talia Rossi. My mission is to guide women toward a longer, healthier life with the confidence of feeling good in their own skin through longevity and aesthetic medicine. Today, I'll explain why microneedling works, what real benefits it can offer the skin, and how to integrate it into an aesthetic medicine approach oriented toward longevity. In the scientific literature, microneedling is described as a procedure capable of stimulating collagen synthesis through controlled micro-injuries in the dermis. Histological studies show that after treatment, there is an increase in type 1 collagen, essential for firmness, type 3 collagen, typical of regenerating tissues, type 7 collagen, important for the dermal-epidermal junction. In the following weeks, dermal fibers undergo progressive remodeling, making the skin more structured and resistant over time. This is the first major benefit. We're not filling, we are rebuilding. Microneedling activates a transient, brief, and controlled inflammatory response, which stimulates growth factors such as TGF-beta and PDGF, fibroblast proliferation. So fibroblasts are the cells that produce collagen, elastin, and the extracellular matrix. With age, they become slower. Microneedling wakes them up. Result: skin that is denser, more elastic, more vital. This is a key benefit from a longevity perspective, helping the skin do better what it already knows how to do. Clinically, what is most often observed? Improved skin texture, more even and luminous skin, reduction of fine wrinkles, less visible pores, a sensation of skin that feels thicker and more toned. This happens because newly formed collagen makes the dermis more structured and better able to support the epidermis. This is not just an aesthetic effect, it's a tissue quality. The effectiveness of microneedling depends on fundamental technical factors: needle length, session frequency, healing times, energy used in the case of radiofrequency microneedling. Studies show a direct relationship between stimulus intensity and tissue response. Translated, more stimulus is equal to more response, but within biologically intelligent limits. When parameters are well chosen, the benefit is maximal and physiological. Histological studies confirm the increase in collagen, but they also tell us something really important. It's not just how much collagen, but it's how it's organized. After mechanical stimulation, fibers may initially be more heterogeneous, with a greater presence of type 3 collagen, and this is not a problem if the process is well guided. The literature shows that a good recovery phase and the proper modulation of inflammation favor a more orderly and mature remodeling. In this sense, combining microneedling with PRP has shown increased type 1 collagen and a greater dermal uniformity, an additional benefit for those seeking quality and durability of results. So seen from this perspective, microneedling becomes a non-ablative biostimulation and proportional to the tissue's reparative capacity, useful for maintaining skin function over time. It is not an aggressive treatment. It's a way to train the skin to renew itself better, especially when, with age, this process slows down. Skin longevity means responsive skin, not tight skin. Like any medical treatment, it must be personalized. Response can vary depending on phototype, scarring history, inflammatory state of the skin and of the body. And with correct parameters and good photoprotection, microneedling is well tolerated and safe in the vast majority of cases. Microneedling works because it stimulates collagen and elastin, improves the dermal structure and quality, supports the skin in its natural renewal process. So used thoughtfully, it is a valuable tool in aesthetic medicine, oriented toward the skin longevity, not just immediate effect. If you want to truly understand your skin and not just cover it or fill it, subscribe to the channel and hit the bell. Every week, I explain how to build a longevity routine designed for your body, your skin, and your current stage of life. Now tell me in the comments, what was the first sign that made you realize your skin was changing? If you'd like a personalized path of longevity and deep well-being, you can contact me privately. We'll build your program together based on medicine, listening, and strategy. On my website, you'll also find other content dedicated to what I talk about every day, longevity and beauty, as part of the same story. See you in the next video.